Alright, so let us begin with day 28 of Alan's keynote study streak, and today we'll discuss sepia and sanguinaria. One of the most ignored remedies when we give something in acutes like naxomica or sulfur, and we need to prescribe something for acute, subacute, further, or in chronic state of the patient. Sepia is valuable because it's very much closely related to nux vomica and sulfur. So sepia in Allen's keynotes we see it mentioned that it is adapted to persons of dark hair, rigid fiber but mild and easy disposition. So it seems like pulsatilla, but in the relationship if you read, it is mentioned that it is inimical or incompatible with pulsatilla, or it should not be given before and after. So whenever you are in a case where you need to think about different remedies, different differential remedies which you are thinking in the case, be sure from the physical particulars and physical generals. What are the physical particulars and physical generals for sepia? We'll see in a few minutes, but before that, there are mental generals. Anxiety with fear, flushes of heat over face and head, about anxiety about real and imaginary evils, and anxiety towards evening. So I had already discussed in many sessions earlier, and I'll repeat it again. Whenever you are reading Allen's keynotes, you need to understand that when a word is mentioned in the beginning, for example, causation from, and there are two dots, and then there goes the symptom, and then there will be a semicolon which will end the statement, and then you will have to again go back to the first word and then come back to this point where the semicolon ends and the next word starts. So in Allen's keynotes, if you have Allen's keynotes right now with you, those who are newly joined, they can just open Allen's keynote sepia, and in mental generals it's written anxiety with fear of flushes over head and face, and then it stops, and then we go back to the first word which is anxiety about real or imaginary evils, and then again anxiety towards evening, great sadness and weeping, dread of being alone, of men, dread of meeting friends, dread of with uterine troubles. So someone who has lot of you know sad, miserable life and unfortunate feeling, she will weep when she is sharing her sickness. We discussed about another few remedies when the patient is weeping. So you can share those remedies below in this video or in my WhatsApp community where you are a part of. We will have this interesting quiz today which has weeping talks when weeping. We all know the main remedy which is pulsatilla, but I need answers apart from pulsatilla because it's a very common answer. She will weep everywhere and anywhere. Okay, so we will read further, and we see that there is indifference even to one's family, to one's occupation, indifferent to one's family, indifferent to one's occupation, indifferent to those whom she loves best. Other remedies mentioned are fluoric acid and phosphoric acid. So you must be thinking that someone who is indifferent right in front of you when you are when you are seeing the patient, you would maybe not so much be getting this clue easily. But what I suggest is you should ask the entire history of the patient, and this indifferent stage which you are seeing, this will come after a long time. It actually starts from something which is what she does not like to do and she has to do. Go in the repertory, check the rubric, undertaking things opposed to her intentions. There are only three remedies: sepia, phosphorus, and magnetis articus. All these three remedies have the feeling that they have to do something that they don't want to do. Sepia is one of them. From this stage, the journey of sepia, which you see in different materia medicas expressed as indifference, it starts, and then it slowly lands into the stage of indifference. In fact, this stage of undertaking things opposed to her intentions comes uh, even in the middle part of the phase. But before that, she may be caring, she may be loving, she may be very much anxious about her relatives, her colleagues all around. So you have to understand how the remedy evolves rather than just take it directly that what you see is what what you see it mentioned in the materia medica, you will see it exactly. It's not always true. So you will have this indifferent stage after a long time, and in sepia there is indifference after a very long phase. For example, sepia we are giving in climatic patients. Sepia will come in handy in such cases where women have been through a troubled marriage for 10 years, 20 years, and they have been uh, dominated or criticized or told that they are not so good in certain things, or there is a family quarrel, and etc., which leads them to the stage of depression or indifferent feeling, and then you get this stage. Then you have the symptoms in the Allen's keynotes, which is greedy, miserable, like the remedies Lyco. Indolent, does not want to do anything, either work or play. Even an exertion to think is not good for her. So this completes the mind state. It's very less. I would say it's 0.05%. We need to understand about the mind of the sepia from the other aspects. But mind will always be deceptive. What you can do is you can rely on physical generals, physical particulars to make your prescription more stronger. Anxiety about family, anxiety about health will be there in 100 remedies, will be there in 200 remedies. But if you have something which is physical particular, something which is physical general, very strongly indicated in the case, very strongly mentioned by the patient, then your prescription is more steady on certain grounds rather than something that is interpretation, which many of the practitioners these days do. They interpret what is seen in their clinics, what from the different patients, and they would probably take a rubric and prescribe the medicine. Let's go to physical generals of sepia. Diseases that are attended with sudden prostration and sinking faintness, like the remedies Murex and Natramur, and it is the washerwoman's remedy. Complaints that are, for example, why is it a washerwoman's remedy? Because it is useful in patients who have complaints that are aggravated by laundry work or after laundry work. Pain extend from the other parts to the back, and if it is from the back to the other parts, it is sabina, and they are attended with shuddering, they tremble with the pains. If it is with chilliness, it is pulsatilla. So pulsatilla has a very peculiar thing, and if you have studied that in one of the sessions we did earlier, if you have read it again, also from not only from Allen but from different books, you will see that pulsatilla has one-sidedness. Pulsatilla has chilliness with many complaints. It will be with her physical complaints and with her other parts, whatever are affected throughout the body. And that is why we should always see what is happening to the patient as a chief complaint and what is there with the chief complaint. If it is more of weakness, more of exhaustion, we should think of remedies like sepia, carbo veg, carbo animalis, kali carb. If it is with chilliness, we should think of pulsatilla. If it is with lot of flatulence, again carbo veg would come, naxomica would come, etc., etc. Then we have particularly sensitive to cold air, chills so easily, lack of vital heat, especially in chronic diseases. So there is lot of chilliness. Patient can't bear cold air, cold draft. By least exposure, they will get affected, and they have this kind of a feeling going on through many months and years. Sensation of ball in inner parts during menses, pregnancy, lactation with constipation, diarrhea, hemorrhoids, leukorrhea, and all uterine affections. Faints easily after getting wet from extremes of heat or cold, riding in a carriage, while kneeling at church and other places. So there is this kind of a faintness which you see very strongly in Ignatia, because they are hysterical patients and they will always exhibit symptoms which are more hysterical in nature. It will happen in public, it will happen in places where there are lot of people, they want to attract some attention. You will see this in sepia as well, but in Ignatia it is more of hysterical nature, whereas here in sepia it is more of you would say, because of the disease, the weakness has been going on since many months and years. Then we have all the coverings in the neck feeling too tight and were constantly loosened, like we saw in the remedy lachesis. Lachesis wants everything loose, sepia also wants everything loose. And when you have a patient in your clinic who will give you an entire history, both the remedies will be running parallel to each other. It will be tough to differentiate. Loquacity will be there, they will be VP, they will be angry, they will have anxiety, they will have jealousy. There will be many elements, and these all elements are there in all the remedies. But as I told earlier, you will need to fix your foundation on some physical particulars or generals to prescribe. Otherwise, you are being misled if you interpret the mind, and you are leading nowhere. Then you have something which is port-belliedness of mothers. If it is of children, then you think of sulfur. If it is port-belliedness of mothers, someone who is not able to share the weight, especially in the belly region, and they are a mother of one or two or three kids, you should think of giving sepia as the remedy. Of course, the other symptoms should match. Children, if they have port-belliedness, they crave for more sugar, they have more behavioral disorders, and they are more intelligent, think of sulfur. Then you have something which is erethism, flushes of heat from least motion with anxiety and faintness, followed by perspiration over whole body. Climacteric erethism or climacteric troubles usually call for sepia. Other remedies mentioned are lachesis, sanguinaria, sulfur, and tuberculinum. Everything ascends from the pelvic organs. So if I were to classify my trio of climacteric for patients, I would say, in fact I would say 4 remedies for climacteric rather than a trio. My choice would be sulfur, sepia, lachesis, and sanguinaria. This sanguinaria is the other remedy which we'll be discussing today. These 4 remedies have all the traits and all the symptoms what you see in climacteric women. They will be troubled with symptoms which go on for months and years, and if you wish to relieve them and help them, there is a good chance that any of these remedies based upon their physical particulars, generals, and some mind symptoms will help you correlate and prescribe one remedy. Everything in sepia is from the bottom to the top, ascends. So whether it is any physical problem or any acute or subacute condition, everything ascends from bottom to the top, and that is what also happens in climacteric. they cannot explain what is happening. In Marathi language, many women have complained, kahitari hote. In Hindi, it's called as कुछ तो हो रहा है, अजीब सा फील हो रहा है, गर्म लगता है, ठंडा लगता है. And they are not able to explain these things because it's a kind of an imbalance of their heat regulation, where sepia is going to work beautifully, and it's going to help you in many of these cases where everything is ascending from the bottom to the top, like a heat is extending. There will be coldness of the vertex with the headache. We saw that there is heat of vertex in sulfur, heat in the different parts in sulfur. We saw coldness in different parts, which is there in calcarea. But coldness of vertex with the headache is very peculiar of sepia. You may get in some cases. Similar presentation we also see in veratrum album. Then we have headache in terrific shocks at menstrual nisus with scanty flow. And this is the climatic phase, which is explained over here, and the flow reduces and causes headache to them. In delicate, sensitive, hysterical women, pressing and bursting pains aggravated by motion, stooping, mental labor, and better by external pressure and continued hard motion. So something that is troubling in the head region, upper part of the body, in the climatic age with scanty flow should point you to think of sepia. Great falling of hair after chronic headaches or at climacteric. Yellowness of the face, conjunctiva, yellow spots on the chest, a yellow saddle across the upper part of the cheeks and nose, a telltale face of uterine ailments. So the face is very much expressive. If there are moth spots, if there are butterfly like spots and all these discolorations, you should mostly think of sepia, because this is a remedy which has irregular hormonal distribution and it corrects it very easily. Tongue foul but becomes clear at each menstrual nisus, returns when flow ceases, swelling and cracking of lower lip. In GIT, we have painful sensation of emptiness, all gone feeling in the epigastrium, relieved by eating. We also see the same symptom in chelidonium, murex and phosphorus. So emptiness in certain parts of the body, you would see that very strongly in phosphorus and sepia. I have not prescribed murex for that indication, but it's a good chance to prescribe murex based upon all the indications, especially if it is a hysterical case. Constipation during pregnancy, like alumina. Stool is hard, knotty in balls. Insufficient, difficult, pain in the rectum during and long after stool, like the remedies nitric acid and sulfur. Sense of weight in the, or like a ball feeling in the anus, not better by stool. So this sense of weight and sensation of ball is there in many different parts of the body. And if you are able to elicit this in your clinics from the patients, it is going to help you prescribe sepia as one of the top remedy for this indication. Many of the homeopaths are scared to give homeopathic medicines in pregnancy, but believe me, if you give some medicine in pregnancy, like here it is mentioned that sepia is indicated for constipation during pregnancy, it is going to correct a lot of things and set many things all right. It does not just go by saying that you should just give it for constipation during pregnancy. There should be some other symptoms, some mind aspects, some physical journals, some physical particulars which should point you towards sepia, and not just give it directly anyhow. And this sense of weight or sense of ball in the inner parts, or if she had it in the past, something will make you a combination to prescribe sepia. In the urinary system, there is a very strong symptom, which is that the urine deposits a reddish clay colored sediment which adheres to the vessels as if it had been burned on. Now this can be possibly seen only if you get the picture of the urine, or else you tell them to urine in a separate bowel and check the urine. like the previous homeopaths used to do. I have already shared that in many other videos so far. And very strong symptom is urine is very offensive, must be removed from the room immediately. Something which is very smelly, of a strong smell, you should think of sepia, whether it is perspiration, whether it is the menstrual blood, whether it is urine, whether it is stools. It is like, I would establish a corollary to this, and I would say that it is something like the ink of sepia which it secretes is like an indelible ink. It stays for a long time in whatever object it lays the ink, and many things are prepared from it. So similarly, all the discharges, and it's a discharge, the ink is a discharge from sepia, the mollusk. And similarly, whatever discharges happen from the female would be indelible, and if you wish to take that aspect for prescription, you would be getting a good success rate in your clinics from that point of view. Also, there are psychotic remedies have this kind of a indelible discharges which keep on excreting. Next is what we have is that child will pass the urine, especially in the first sleep, the first part of the sleep. Enuresis bed is almost wet as soon as the child goes to sleep, like creosote, always during the first sleep. So whenever you have a case of nocturnal enuresis, try to ask whether the child passes urine in the beginning of the sleep or in the early part of the morning. Most of the cases you will get in the first sleep, some cases you will get in the later part of the sleep, which is early morning. And accordingly you will have to define, and also if it is with dreams, without dreams, and the other reasons that are there. Sepia will work very well in such cases where there is first part of the sleep where there is nocturnal enuresis. Diseases of women, especially those occurring during pregnancy, childbed and lactation. In fact, we missed one symptom which was there in urine, which was about dyspnea, aggravated sitting after sleep in room, better by dancing and walking rapidly. So this symptom which is there in respiratory, which is a part of a respiratory symptom, is mentioned in urinary chapter, which is very interesting because this kind of makes you think that this symptom must be more of a concomitant symptom for the urine symptom, which is the chief complaint. Then we go to female reproductive system. I read the first symptom, which is mainly that you should think of sepia as the remedy for pregnancy, for women who have delivered children and women who have lactation. There is gleat, painless, yellowish, staining linen. Again you see staining linen. Meatus is glued together in the morning, obstinate, of long standing. Kali iode, sexual organs are weak and exhausted. Kali iode is also one of the other remedies which has such indelible discharges which are of long standing and become very syphilitic in nature. Then there is violent stitches upwards in the vagina, lancinating pains from uterus to the umbilicus. So you see that this is again an upward symptom which is present. Wherever you have physical symptoms in the patient, if the patient is giving you symptoms that I am having respiratory problems, I am having menstrual problems, I am having knee pains and back pains, ask which complaint started first. Chances are for giving sepia, you may get that something started in the bottom and then affected the upper parts. Second possibility is that some sensations of the patient may begin in the lower part of the body and then travel upwards, or there will be a connection between some organs where there is more of upward sensation which is mostly experienced by the patients. Then we have something which is prolapsus of uterus and vagina. I have a case of rectocele which is going on very well on sepia. Pressure and bearing down as if everything would protrude from pelvis, must cross the limbs tightly or sit close to prevent it with operation of breathing. So all these women who land up in your clinic and they have this kind of a cross leg posture to sit, they should be given sepia, lilium tigrinum, murex, and those class of remedies where they always have the feeling that something will push downwards and come out, or there is a sensation that something is pushing downwards. Remedies to compare are agaricus, belladonna, and sanicula, lilium tigrinum, and murex. There is a form of irregular menses, late, scanty, profuse, amenorrhea, menorrhagia when associated with any of the above symptoms. Morning sickness of pregnancy, the sight or thought of food sickens the patient. Smell of cooking food nauseates, like the remedies Nux moschata, arsenic, or colchicum. So it is one of the top remedies you should think of in cases of early pregnancy where there is lot of vomiting and they can't bear to look at food. Herpes cercinats in isolated spots of upper part of the body. So all those cases where you have ringworms, where you have the herpes like symptoms or ringworms, you should think of sepia as one of the top remedies, because the expression is very much evident of something that is localized, something that is happening in that part, and it does not leave the body easily like an indelible stain of the ink of sepia. If it is in circular patches all over the body, you should think of tellurium. If it is only on the upper body, you should think of sepia. Itching of the skin of various parts of external genitalia and is not better by scratching and is apt to change to burning. So all those cases of jock itch and people who have itch in the groins, you should think of sepia as intercurrent or the main remedy to help them come out of this phase. Other remedy also being sulfur, I would say Merc-Sol is also very close. Protontic is another remedy, clematis is another remedy. Modalities for sepia in afternoon or evening from cold air or dry east wind, sexual excesses, aggravation at rest, aggravation moist weather before a thunderstorm like the remedy sorinum, amelioration from warmth of bed, hot applications, violent exercise. Many symptoms, especially those of head, heart, pelvis, are both aggravated and better by rest and exercise. Sepia also tries to antidote the mental effects of overuse of tobacco, and in patients who have sedentary lifestyle, those who operate on certain PCs or they are sitting in one place for a long time. So you have to understand what happens, and once you understand this, the whole remedy of sepia opens up. When you sit for a long time in one place, there is a stasis of the body, stasis of venous circulation, stasis of everything that is there in your body which should move. This stasis is one of the main reasons why sepia state develops on the physical body. Once it develops on the physical body, it may create a situation for the patient to behave in a weird manner in their external surroundings, causing a state of sepia to develop over a period of time. Venous stasis and sepia would be more like synonymous, because sepia is a very good portal congestion reliever, and it is to be given in patients who are in a single place, there is venous stasis, and the physical symptoms have developed because they are sitting in one place. So I would develop more of these ideas in some other video in some future, but for the moment, if this is understood, this would help you give a glimpse of how you should elicit from different patients about the symptoms. Very strong complementary remedy is natramur. If you are giving sepia, you should give natramur as intercurrent. If you have given natramur, you should give sepia as intercurrent. Both work in conjunction with each other. It is not that you should give one remedy only all the time to patients and stick to one remedy. You may require to give a complementary or a series of remedies, for example sepia, sulfur, or you have given nux to in patient in acute, and then you need to give sepia. So in this way you need to juggle between different remedies according to the physical states and mental states and achieve a cure. Lachesis and pulsatilla are inimical, I already shared, but Lachesis, Sanguinaria, sulfur and Ustilago is mentioned for climatic disturbances, and it is a very long acting remedy, so a single dose may act curatively. But I have seen that I have always some patients I have given it in repetition, it does not cause any problem. If the state is deeper, you may need to give it for a longer period of time and then put them on placebo. So I started on this session today by sharing that if you have given nux vomica and sulfur, you may need to give sepia. I would say that they are also one of the cycle of remedies where if you have given nux to a patient in acutes, you may need to give sepia in their chronics. Let me explain you how. So there is a kind of a chaos in nux vomica and there is a kind of a chaos in sepia as well. Both are chaotic remedies. Chaos is in the circulation because there is venous stasis, and if venous stasis is not cleared, someone who is in normal behavior, someone who is at ease becomes diseased, and this is what causes the state of mind to become irritable and snappish and angry. So movement is very important. Sepia, nux vomica and sulfur, all these three remedies the state develop because they do not move or they are unable to move because of the circumstances, and they would need to be repeated in a cyclical manner, nux sepia sulfur or sulfur nux sepia, something like that. This is what my observation is. I don't know what other authors have told. So let's move on to sanguinaria. This is one of the top remedies which is ignored for patients in their climacteric age. It is a very good remedy for migraine. We all have given it, but let me share something which is mentioned in Helen's keynotes and then we'll come to some explanations. Periodical sick headache begins in the morning, increases during the day, lasts until evening. Head feels as if it would burst. Similar feeling is there in Glonoine, as if the eyes would be pressed out, and the patient is relieved by sleep. All the migraine patients will tell you the same pathophysiology, the same symptomatology. So sanguinaria is not the only medicine. Try to confirm from the sensation, try to confirm from the modalities, and then prescribe the medicine. Further down the line in Allen's keynotes for sanguinaria, we have American sick headache, better by perfect quiet in a dark room. And there are two remedies given, epigia and indigo. You need to read about them for differentiating from sanguinaria. For sanguinaria, the headache begins in the occiput, like we saw in nux remedies, like we saw in some other remedies. Silica also was one of them. But it spreads upwards and settles over the right eye. This is also there in sepia. If it is there on the left eye, think about spigelia very strongly. And one of the top complaints that women in the age of 40s and 50s would give you, that there is a kind of a headache and I am not able to understand or describe the sensation. That is actually nothing but headache during the climactic period. You should think of, say, sanguinaria as one of the top remedies. If there is an upward rising sensation, we discussed about it in sepia, you should think about sepia. For such headaches and for such climactic period, you can also think of sepia and sanguinaria as a kind of a complementary remedies, or going along with each other, one after the other. Or if there is a phase where you need to give nux and sulfur and sepia, you think about that line of thought. So it will all depend on the patient in front of you. Headache which happens every 7th day is sanguinaria. Sabardilla, silica and sulfur are there again similarly. If it happens at 8th day, it is iris. Now this kind of a peculiar observation you will get in some patients, not always. So don't rely on only this symptom, but the other sensations and other modalities. I would say that modalities are more reliable than the sensations because people don't access their sensations much often. they would be more observant for their modalities rather than the sensations. In Sanguinaria, we have in Allen's keynotes neuralgia of face, better by kneeling down and pressing the head firmly on the floor like you are praying to the god in a temple. Pain extends in all directions from the upper jaw. Circumscribed red cheeks in the afternoon, burning in the ears in bronchitis, pneumonia, phthisis. Asthma after the rose cold, aggravated from odors. So anything that has to do with perfumes, agarbattis, incense sticks, or something that is causing air to get toxicated and causing problem to breathing for the patients, think of sanguinaria. Laryngeal or nasal polyps, think of sanguinaria, also the other sanguinaria compound, sorinum and tucrium maramarum. Lot of nasal polyp remedies also we have discussed in the last 28 days. Cough is at dry, waking him at night, not ceasing until he sits up in the bed and passes the flatters. Circumscribed red cheeks, night sweats and diarrhea. So I already discussed in few lectures earlier about the typical presentation of cough of different remedies, and for me it is like I just observe the patient. Number one thing, when they land in clinic, the first thing you need to do is observe if they are coughing. If they are not coughing, then you need to rely on their version, which can be difficult to rely upon. Secondly, you need to ask them about modalities. So modalities can vary from lying down to sitting on mirrorage to going out in open air or warm room or cold room. And then what is happening with the cough symptom, that is what you need to rely upon. So there are different permutations and combinations, and I am kind of listing them down for a better understanding with the video cases that I have. And maybe after my fever workshop, which begins on August 15, I will be doing a workshop on mastering the coughs. So it will be a good journey for all those who wish to join for mastering coughs after the fever workshop. So in Sanguinaria, we have something that is more of dry cough, which makes him sit. This is also there in conium, this is also there in hyoscyamus. If the patient feels better by lying, it is causticum. If the patient feels aggravated by lying and has to sit up, the remedies are sanguinaria, one of the remedies, and hyoscyamus being another remedy, and conium also in another remedy. But in hyoscyamus, there will be more of a tickling which is there, and it is more of a dry cough rather than they are able to expectorate. In sanguinaria, it is mostly the gastric symptoms which will be accompanied with the cough, so or the irritation which will be accompanied with the cough. So if you catch hold of any cough patient who complains of lying aggravates and he has to sit up, ask them if there are irritations or if they pass flatus. If not, then don't prescribe sanguinaria. Interesting thing about certain remedies is that after a epidemic of cough which happened in the recent winters, and I have put up a collection of how a homeopath should analyze different coughs when they land in clinic. Do go to the timeline and you will see it mentioned on my Instagram, Interning Online, where I have given that how we should classify coughs, and there are 3 things that you need to understand. So in sanguinaria, you see that there is severe cough. After whooping cough, the cough returns every time the patient takes cold. So perfumes affect him, incense sticks affect him, the toxic air affects him, and then it lands him into the cough problem. That is sanguinaria. And if it also happens after an epidemic of cough which was going on for some time in his locality. And you see something that is mentioned, burning in pharynx and esophagus. Then you have rheumatic pains in the right arm and shoulder. One of the most underprescribed remedies for frozen shoulder is sanguinaria. Think of this remedy if there is right shoulder affections. It is the 4-mark remedy in complete and 5-mark remedy in complete. many rubrics. And in Kent repertory you see it as 3 marks. In Bonnie-Mosen repertory, BBCR also, you will see it as 4 mark remedy. So you need to understand, if a patient has frozen shoulder right side, think of sanguinaria, left side think of ferrum metallicum. It is so bad that they cannot raise their arms, and especially aggravated at night. Another symptom which is very peculiar, and this I have seen in cases as well, pain in places where bones are least covered, as the tibia, back of the hands, etc. The remedy given here is Ras venenata, but I have prescribed many such patients cases as well. Sanguinaria is something new which I am reading from this point of view, but you can think of the cases also. Keep in mind the other remedy mentioned is Ras venenata. Climatic ailments, flushes of heat and leukorrhea, burning of palms and soles, compels to throw off the bedclothes, painful enlargement of breasts when the cases and sulfur fail to relieve. So there is a kind of a heaviness which they feel, or fullness in the body in certain parts, upper parts. Those things, along with flushes of heat, along with burning in the pharynx and esophagus, you understand how you need to connect the different components of the case, bring them together and prescribe. So it's like you are repertorizing without the repertory, but just by memorizing the Allen's keynotes and bringing together the different components. That is the reason why Kolkata homeopaths have been masters of homeopathy in the country, I would say in the world, because they have this ability to bring together the components and prescribe medicines, and they are also relying more on the physical generals and particulars rather than the mind, which the Western homeopaths and the homeopaths the world across are relying upon, which is very dicey and based upon interpretation. If you want to succeed, you should rely and base your prescription on something which is physical particular and physical general, rather than a broad theme or idea which is going to be depending upon your interpretation. So we saw sanguinaria, which is mentioned for such climatic ailments, and it will have eructations, gastric ailments and flushes of heat, and there will be eruption on the face of young women, especially with the scanty menses. The same is there in Bellispur, Calcarea carb, Eugenia jambusa and Sorinum. You can compare sanguinaria with belladonna, iris, melilotus in sick headache, lacasis and sulfur in climatic affections, chelidonium, phosphorus, sulfur and veratrum viridi in chronic bronchitis and latent pneumonia. One of the most underestimated remedies for chest affections is sanguinaria. The problem should start from a cold which is aggravated from the odors, the toxic air around them, and they get affected with a cold, and then it travels to the chest. If this symptomatology is there for the respiratory ailments, for the pneumonia or for the chest trouble, then think of sanguinaria as the remedy. If the other patterns are there, then you have chelidonium, phosphorus, sulfur and veratrum viridi. And if there are some side effects or bad effects of opium, think of sanguinaria. If sanguinaria fails, if belladonna fails in certain cases of skin problems or throat problems, think of sanguinaria again. So that brings us end to today's session of sepia and sanguinaria, and it was day 28 of Allen's keynotes study streak. So this will continue till the time we finish the entire Allen's keynotes. In the last 28 days we have covered maybe 70-80 remedies or around 70 remedies, I believe. Anyways, see you all tomorrow, and I hope it's kind of helping you all. If there are any questions, please drop by so I can find out what is the best answer to it, and we end the session. So I think no one has any questions. So I would suggest you go through Ellen's keynotes and uh, keep the learning going on every day, whether it is Allen, whether it is Boric, or whether it is any Matina Medica. One remedy a day or two remedy a day would keep your worries away. So thank you all for joining.